we're going to release the scalenes muscles in the neck. So right in the very front of your neck is the trachea. And then there's this head turning muscle, the sternocleidomastoid, and right underneath that lives the beginning of the scalenes, the front scalenes and then the middle scalenes. Those are the scalenes muscles we're going to focus on. These muscles are important because they stabilize your cervical spine, so your neck area. They tilt your head side to side. And the brachial plexus nerve bundle that innervates the shoulder, the arm, all the way down into the wrist and the hand runs in between the anterior and middle scalenes. So when these muscles get really dysfunctional, out of balance, or carry a lot of tension, they can pinch off that nerve bundle and cause all kinds of sensations like pain in the chest, pain along the back of the shoulder blade, pain, numbness, tingling, and various nerve sensations that travel down the arm to the first two or three fingers, or the back of the arm and the last couple of fingers. So any kind of nervy sensations that travel down the arm, I always want to check into the scalenes and make sure that they're okay. So we want to use a soft ball. So the softest ball that you have, something that has give to it, because you're working in the neck and we don't want to shock this area. I also recommend that you use a yoga block, or if you have a Tupperware container, that'll work, or a shoe box, something like that. And you'll see why in a moment. It's going to give space for your shoulder and your neck. So I always like to take a nice breath and kind of settle myself before I'm going to work in my neck. We want to be really focused and mindful in this area. I'm going to take my block and place it on the wall so that my shoulder can duck underneath it. Okay, so if I have to scoot it up, I can just scoot it up. And I'm going to take my larger, softer ball, and I'm going to be right next to the trachea. So I'm going to put it right on the block, right next to the trachea, and I'm going to relax that arm. I can use the other hand to stabilize the block if I need or not. And then I'm just going to slowly bend and straighten my legs. And I want to go up right next to the trachea, not on the trachea, right down to the collarbone, and then back up to the base of the skull. So because these muscles, I want to be mindful I don't drop the ball off of the block, which happens sometimes, not a big deal. I'll just pick it up and keep going. So stabilizing the block is a good idea. And as I work through this area, as I find some tender spots, I want to try to keep my head in neutral through most of the practice. But then as I find a tender spot, I'm just going to drop my head side to side. And that's going to be my pin and stretch for this area, dropping my head side to side. And it might feel a little bit like you're pressing right up to the spine. And that's a good thing. You are. That's why you want to use a softer ball in this area. And then I'm going to move the ball toward the very side of my neck a little bit more. I'm going to get right in front of that. And same thing. I'm going to bend my knees and straighten-ish and bend. And just move up and down along this area. If it gets a little nervy feeling, just move slightly to the front or slightly to the back by rotating your body just a little bit. These points can feel nervy, so it might be hard for you to discern if you're actually on the nerve or if you're on the muscle pressing into the nerve, which is totally fine. Take a breath, which is why I really highly recommend, again, a softer ball. If you're using a very firm ball in here and you are digging into the nerve, you can cause some damage. So use a really soft ball. Work with your breath. Be very mindful and gentle here. I might move the ball up a little higher on the spine and work in that area some more. Middle scalenes. When I get to the very center of middle scalenes and I sink in, I can feel that moving down my arm. And so I'm just going to back off the pressure a little bit. Feels really good there. I'm going to take a breath. And then I'm going to keep exploring and just working around the neck, working to the side, moving up and down by bending my knees and straightening my legs. Again, I found another spot, so I might pin and stretch. I just keep adjusting my body. I keep adjusting my body so that I'm as comfortable as I can be. And then I tilt away and then lean back and tilt away and then lean back. Then I might even rest my head almost on the ball and just take a couple breaths. Great. And so that's the scalenes on this one side. So I want to bring a little tension and stretch to the muscle by tilting my head toward the shoulder and then leaning my head away. And now I just release this right side, and you can just keep exploring around the neck a little further back if you feel the need. I feel now that as I lean this ear toward my shoulder, this side of my neck feels really open. This one is still kind of sticky and tight, so I want to go ahead and do the same thing on the other side by using my block or my shoebox or Tupperware container, ball there, just outside the trachea, down by the collarbone, up and down. Spend a little time exploring. Shift a little further, wider, go up and down those middle scalenes, exploring all around. Just find the movement that works for your body. And if you've ever had a whiplash, this will be really beneficial to you as well. So releasing the scalenes.